MCQs 154 is the speech receptive area of the brain is called B. Wernicke's area. MCQs 155 is a physical therapist examines an 80-year-old male patient in an outpatient clinic. Before reviewing his patient interview form, the therapist noticed that the man is barrel-chested, his sternocleidomastoid and trapezius muscles are hypertrophic, digital clubbing of the fingers is present. On the basis of these physical observations, in what organ system does the therapist expect to see dysfunction? Pulmonary system, ठीक है, because barrel shaped chest है उसकी, ठीक है, और ट्रेपीजियस मसल्स स्टेनोक्लेडोमास्टॉइड मसल्स जो है वो हाइपरट्रॉफिक में है, क्लबिंग ऑफ फिंगर्स हुई है, इट इंडिकेट पल्मोनरी सिस्टम इज इन्वॉल्व्ड. ऑप्शन डी वुड बी द राइट आंसर. MCQs 156 is a physical therapist is monitoring a patient during aerobic warm-up in the clinic. The patient medication list includes tricyclic and antidepressants. Given this information, which response can the physical therapist expect when the patient begin to exercise? So heart rate जो है वो increase होगा. Heart rate increases greater than normal. Option C would be the right answer. MCQs 157 is the following handicap is not eligible for job reservation in central government for C and D post. Locomotor, mental, hearing and speech, and none of the above. D. None of the above. 158. Fluorotherapy contains warm water in large cabinet, warm in room temperature, cold water in large cabinet, mass of tiny cellulose. D would be the right answer. Fluorotherapy contains mass of tiny cellulose particles suspended in moving air. MCQs 159 is a therapist attempts to have a patient quantify his pain during a subjective pain scale. The therapist explained to patient that he should assign a numerical value between 0 and 10 to describe the pain. Which of the following would best describe a score of 10? D. Most severe pain. Option D would be the right answer. MCQs 160 is most unstable spinal injury is flexion rotation injury. This is one of the most unstable spinal injury. MCQs 161 is pump handle movement is a feature of lower ribs, upper ribs, mid ribs, diaphragm. Option B is correct, upper ribs. MCQs 162 is side flexion of head and neck to right includes. These are the options and they are lengthy, so इसलिए मैं पढ़ नहीं रही हूँ. I'm going to tell you the right option, that is option A. Side flexion, rotation of lower cervical spine to right with slight extension and full of rotation of atlantoaxial joint to left. Side flexion of atlanto-occipital joint to right in slide flexion. Option A would be the right answer. Next is MCQs 163. A physical therapist evaluates a wound that has hard black tissue throughout the open area. The therapist documents the amount of this tissue in the patient chart. What term should be the therapist to correctly identify this tissue? Option B would be the right answer, scar. MCQs 164 is a physician has ordered a specific type of electrical stimulation that utilizes a frequency of 2500 Hz with a base frequency at 50 Hz to achieve fused tetany. Which type of electrical stimulation has the physician order? So it will be a Russian, I guess. This is an example of Russian stimulation. Okay, so option D would be the right answer. Okay, so let's come to the MCQs 165. Which of the following statements regarding interferential current therapy is true? Option B is the right answer. In quadrupolar technique, the current at the electrode skin interferences is modulated. MCQs 166 is massage can be beneficial if a client is recovering from pneumonia because. Option A would be the right answer. Appointment and vibration on the chest can help drain the secretion.